welcome to Breakfast with the Chiefs, or Great Minds in Dialogue, as we like to call it. Today with Pablo Rivero. I'm not going to say anything more about Pablo because you have an introduction in front of you, but he's the taller one of the two. I know they're pretty close, but... And you all know Howard. We had a little get-together last night over a glass of wine, and if we can repeat what happened last night, it's going to be a great success, I guarantee you. We've got a Spaniard and a Scotsman trying to communicate, and it's going to be fun. So there'll be questions afterwards so you can figure out what was going on. So I do want you to recognize some of the names you saw up there because they enable this. Normally we charge $100 for everybody to walk in the door, but Jim Shea, for example, pays for most of you people, and it's very kind of him. Accenture, where's Accenture? There's right there is Meg. CGI, Bill Clark, where are you? Anybody? You don't look like Bill Clark, no. But CGI is a good supporter. HP Canada is very supportive of us, and IBM. Anybody from IBM? There's IBM. Good. IBM's here. Who else have we got? Then we get this great support from organizations like Sauder. We work together with Sauder, and most of you know Bob, who's here. All the teaching hospitals across the country, so Howard's Hospital would be one, but certainly the Vancouver Hospital, all the hospitals are very supportive of us, and I want to make sure you don't miss anybody. PHSA, Linda Cranston, who got this series started. Anyways, there's a lot of people involved, and we're delighted to do this. This will be videographed, and the problem is that Pablo has, how many slides did we figure out, Howard?
72.
72 slides. He says he's going to do it in less than 30 minutes, and he agreed to be held to that. If he doesn't, the two of us get $100 each.
And if he does it, he gets $20. So lots of questions, please, in the first 20 slides. Interrupt him.
Pablo, you're on.
Thank you. So thank you for the invitation, and thank you, Anton, for introducing me. And of course, thank you to Howard for sharing with me this event. And in the next 25 minutes, I'm going to speak about the experience of Andalusia, Spain, an experience about modernization of the health system. I don't know if it should work.
Use the keyboard from
It worked before. So experience about the modernization of the health system. And I would like to start with a statement. So no one knows everything, but everyone knows something. So all the knowledge resides in networks. So I'm going to speak about the importance of working in networks and thank you, and the importance of the knowledge. So this is Andalusia in the south of Spain. This is Granada. This is Seville, the capital. You know it perfectly. This is Vancouver in Western Canada. What do we have in common? So we have common challenges. You know it perfectly from the health perspective. The population is aging. The current lifestyle presents major risk to the future health of the population. The disease profile is changing. There is some evidence that the healthcare organization-based and integrated processes approach have better outcomes than those with a silos approach. From the social perspective, we have higher level of demand of information from the perspective of the public, higher level of expectation, and an impressive rise of the social virtual networks. And this is very important in terms of citizen engagement. And from the technological perspective, most of you come from technological companies. You know that one of the big challenges is the convergence of technologies, the virtual networking, and people not only want quality information, but in addition, they want to give us feedback. They want to express opinion and expectations. So we have this environment, technological convergence, In the health sector, we have the most important thing, which is the quality information on health. And we have higher levels of demand of information from the perspective of the public. So the challenge is to create an innovation strategy to transfer this knowledge to the public through these new devices. Andalusia is this province in the south of Spain. This is Spain. This is Andalusia, the green area, with a public health system with 90,000 healthcare professionals, with 41 hospitals to serve 8 million inhabitants, and with an annual budget of $12 billion. So it's a big public health system. With these figures, 54 million of GP and pediatric consultations a year, with this type of hospital stays for millions. And I would like to draw your attention about the average waiting time for elective surgery is 64 days, and there is no one waiting more than 140 days for surgery. So this is important, and this is one of the results of the comprehensive modernization strategy. Modernization strategy based on knowledge management and in internal and external cooperation. Important things for this strategy: leadership. It is the most important thing. Without leadership, you can't do anything in terms of change management. Redesign processes from an integrated perspective. I'm going to speak about that. Involve the health professionals. This is very, very important, to involve the health professionals in the planning and the execution of the change. Focus on knowledge management and, of course, introduce technologies, especially electronic health records, multi-channel approach to the public, but only after clarifying the previous points. First quality plan of Andalusia, 2000-2004, based on redesigning clinical processes, in continuity of care, in knowledge management, and in developing clinical management skills. The second quality plan, 2005-2008, with 5 strategic areas, assuming the needs and expectations of the citizens, ensure quality management of health services, ensure quality of public health policy, knowledge management, and stimulating innovation. So this is the strategic approach, and this is the general scope of the Andalusia strategy. First thing, leadership and clear strategy, with a comprehensive plan for all the government and the strategic plans for the health sector. Redesign clinical processes. I'm going to speak about that. This is the basis of everything, to redesign the care pathways, involving the primary care and the specialist care in the same effort in redesigning the clinical processes. Knowledge management, with electronic health record and with another tools for knowledge management for the health professionals. And of course, the last but not least, empower the citizen with centralized appointment, multi-channel information, interactive services, and gathering expectations. The main strategy is to redesign the clinical processes from an integrated perspective. With the objective of increasing the efficiency, reduce unnecessary cost, improve quality, reduce times, reduce the variable produced in clinics, and eliminate inefficiencies. You know the methodology of redesigning the care pathways, involving multidisciplinary teams of including people, different type of health professionals, people of primary care, people of specialized care, another type of health professionals, working in the same care pathways, in the same clinical processes. Trying to create approach centered in the user, involving the health professionals. This is one of the most important messages. With the best clinical practices, developing an integration information system to support that, and, of course, with the objective of the continuity of care. How we prioritized the criteria in terms of identifying first the diseases and do the reengineering, draw up and implementing a strategy and measure outcomes. So how we identified the first processes. So that was the prioritizing criteria. High prevalence, existing waiting list, social impact, high cost of care, if there was room for improvement, and potential added value for users. Those are the first clinical pathways we redesigned. Now we have approximately 100. Those ones, the first ones. And for example, in breast cancer, this is the results before redesigning clinical processes and after redesigning the care pathways. You can see, for example, the pathology diagnostic report after biopsy from 5 days to the same day, surgical average time after diagnosis for 37 days to 16 days, first visit after GP referral from 8.2 to 3 days, and global patient satisfaction for 85% to 93%. So this is results in a population of 1 million inhabitants about breast cancer before redesigning care pathways and after redesigning the care pathways. This is the virtual tool for the health professionals because it's very important to involve the health professionals in all the moment of the process. And this is you know it perfectly, the differences between traditional management and management by processes, especially have more improvement. The vertical organization coexists with the horizontal one. The management by processes contemplates as well the logistic and support processes, incorporates clinical management based on the evidence, and one of the most important things is the integration of the perspective between the different levels. After redesigning processes, another important thing is the electronic health record. You know perfectly what electronic health record is. It's a tool for integrating all the information with the goal of having all the information integrated and available at any time or any place. This is the diagram of the electronic health record of Andalusia with the database of users, which is the center. Now there are 8 million people in the database with the health record, with centralized appointment, with a multi-channel contact center, electronic prescription, and a strategic module for secondary use of the information and the analysis of the information. The database of users is the center of the system. The system is accessible through the card, the electronic card. Each citizen of Andalusia has this card. It's the key to access to the electronic health record. The number of users in the database, currently 8 million, and this is the evolution through the years. So we have the electronic health records and we have to create innovation, but what is health innovation? So from my perspective, health innovation is to transform knowledge into new services, new processes, and new technologies with the goal of making the system more accessible for the more personalized for the citizen, and also to create better opportunities for professional fulfillment for the health professionals. So health innovation means knowledge. It's not about technologies. It's about knowledge, the most important thing we have in the organizations now, not only the health sector. It's about better organization. It's especially about leadership. Very important, leadership at the highest level of the organization and leadership from the point of view of the health professionals. It's about collaboration, internally and externally. And the technology is not the answer, but allows us to process information and to transform this information into knowledge and to share that knowledge. To share the knowledge is a very, very important thing. 3 types of innovation: innovation in citizen relations, innovation in professional performance via use of the information and communication technologies, and organizational innovation. In terms of citizen engagement, you know it perfectly. This is the new environment. We have the citizens. We have the goal of delivering more information, quality information, and we have a lot of opportunities in terms of new devices and new technologies. So we have a multi-channel environment. On that sense, we created the centralized multi-channel citizen engagement project with a centralized appointment and multi-channel information for the public. The multi-channel appointment through different technologies, to primary care, to specialized care, and to diagnosis test. So you can have, as a citizen of Andalusia, your appointment with the primary care doctor, with your specialized doctor, and do your diagnosis test through web, through regular phone, through cell phone, through email, through SMS for the cell phones, and of course in persons. So normally you can have in 1 minute your appointment for tomorrow, after tomorrow for the primary care doctor, and when you leave the family doctor's office, you can have in your hand your appointment for the specialized care or for the diagnosis care, for the diagnosis test. And this is the evolution of the satisfaction of the public before introducing centralized appointment and after introducing centralized appointment. Electronic prescription. This is how the electronic prescription works. You know it very well. It is very useful, especially for patients with chronic conditions, in terms of not having to go every week only to have the same piece of paper to the family doctor, and you can have the prescription in an electronic way in your pharmacy. Last year we did 40 million of electronic prescription. It's better for the citizen, of course. You don't have to go every week to have the same piece of paper. It's better for the health professional. Last year, we reduced 22% of unnecessary visits to the family doctor. So the family doctors have 22% more time to see the patients who really need it. It's good for the pharmacist system, and is good for from the management perspective in order to control what is going on, and it's good to control how the people are taking the pills and this type of issues, especially important in the senior people. Multi-channel engagement as well through different channels, through regular phone, through cell phones, through web, in terms of not only centralized appointment, but in addition to delivering information about the health topics, information as well through SMS phones about pollen count by province, tobacco, heat wave, vaccinations, reminder to review appointments, methodology programs. So the issue is to have a multi-channels and integrated approach in order to deliver the information and to deliver the services, because after our usability test, we found out that the people want information about the health topics, about services, about facilities. People want interactive services, electronic administration, 24/7 advice, centralized appointment, multimedia services, and people want as well to participate and to give us their feedback. In terms of feedback, we created a bank of expectations of the public in terms of gathering the expectations of the public and to transform it into value-added information for the managers, for the health professionals, and for the citizens. And for the citizens, creating specific panels, specific forums, and general reports. So what about professionals? See, if we say that the professionals are very important. We have to put not only the citizen in the center, but in addition the professional in the center. So we created, for example, the digital library in terms of knowledge management. Before creating the digital library, we have an inequality in terms of access to the digital scientific journals for the health professionals. For example, if you were in Virgen del Rocío Hospital, the biggest hospital in Seville, you had access to 300 scientific journals, but if you were in a mountain area, you have access to 0. So after introducing the digital library, the 91,000 healthcare professionals of the Andalusia health system, they have access to more than 2,000 scientific journals, and with electronic tools in order not only to have access, but to create collaboration spaces and other knowledge management tools. So knowledge management in terms of innovation. In terms of innovation, we created the Bank of Innovative Practices. It's a very simple but powerful idea. Is to put the focus on the health professionals in terms of identifying where the innovation is going on, to support the innovators, and to share that innovation. So it's a very simple but powerful idea in terms of putting the focus not in the deputy minister, but to put the focus in the health professionals who are doing the innovation in the front line. We are not doing the innovation in the central building in Seville with the official cars and the flags. The people who are doing the innovation is the people who are in the front line. So it's to identify what is happening and to analyze the conditions of the innovations in terms of sharing this innovation to the rest of the system and to support the innovators. As well with different strategies and technological tools to support the professionals. So you can see that one of our key ideas was to put the focus on the health professionals, not to put the focus in the political agenda. The political agenda and the people in the ministry, our first role was to support the health professionals and to support this type of initiatives. In terms of international collaboration, in 2006, we signed a memorandum of understanding between Andalusia and Calgary. This is Jack Davis, the CEO of the Calgary Health Region, in terms of sharing best practices, in collaborating in chronic disease management, and in collaborating in citizen engagement. We created the Observatory of Innovative Practices in Chronic Disease Management, creating a common taxonomy in the English world about chronic disease management, because I'm not a doctor, and for me it was a surprise that everyone was speaking about chronic disease management, but there wasn't a common taxonomy about what means what. So it was a surprise. So one of the first things was, of course, to connect different people in the different parts of the world, Singapore, Australia, Canada, Europe, and to create common taxonomy and to create common approach and to share best practices. So everything is about the knowledge. Everything is about the knowledge management. In terms of the future, especially in citizen engagement, the opportunity is the technological convergence. And the technological convergence is an opportunity to create a new model of communication in health. We did it in Andalusia in terms of taking advantage of the opportunity of having these new technologies, a strong process of convergence among the different technologies, because we had the information and we had the expectations of the public. So the idea was to create a spare cataloging of digital resources in audiovisual format with two objectives. First, to share it with the public in a multi-channel way, but in addition, to do innovation in technological convergence, innovation in contents, innovation in creating a new multi-support distribution. And this is the slide which outlines the different ways of sharing the information with the public, through web portal, through mobile phone, through screens in the health centers, through digital TV. This is the website of Andalusia with the videos available online, and you have it available in different channels as well. And this is the topics that the people are interested on: nutrition, relaxation, physical exercise, obesity, baby care, pregnancy, healthy life, emergencies, tobacco, diabetes. So about Andalusia, very important message, leadership, integrated approach in front of the traditional silos approach, sharing knowledge. The Deputy Minister of Innovation, I didn't innovate anything. It was the goal of the health professionals, and the integration of the approach and integration of information is essential. Only a couple minutes about Calgary, because you know that now I'm working in Calgary as a senior advisor, health innovation, and focused especially in citizen engagement. You know it perfectly, the Calgary Health Region and the figures. We have the strategic service plan with some goals in terms of citizen engagement and integrated approach. So we created a specific innovation strategy with the goal of having the integration of the information, involving the community, and promoting a key role of the health professionals. We are working with my colleague Bill Trafford, the Vice President of Advanced Technologies in the Electronic Health Record Project, in terms of integrating all the information in the clinical level. This is the current state, with the goal of having all the information integrated in 2010. From the perspective of citizen engagement, we are working in the integration of all the systems, the record, the different databases. We are going to create a CRM, a Customer Relation Management System, which is a basic tool to, what is that? No. Okay. It was good, but I have a couple minutes more. The customer relation management system in terms of having the same information available through the different channels. So our goal is to move from a system where the citizen has to find the right information in one of the different channels of the different services, to a system where the citizen is the center of a coordinated effort approach in creating customized and value information and services. So the goal is to have a unified view of the citizen in terms of delivering the right information to the right person for the right channel. So we can share knowledge. This is a picture about some Andalusia and Calgary executives in the ranch of Bill Trafford, who is the Vice President of Advanced Technologies. These are two real cowboys. They're two real cowboys. They are taking care of the ranch. And this is the slide that summarizes all my vision about a comprehensive approach in innovation. First thing, redesign clinical processes involving the health professionals. Very important. Without doing that, you can't do anything. Second thing, comprehensive electronic health record. Developing an integrated strategy in terms of creating a unified view of the information. Create and share knowledge with the health professionals, with delivering tools for sharing knowledge, sharing best practices, and management by skills with each professional. It's important as well to create a tool for improving the skills of the health professionals. And the last thing, but not last, to empower the citizen through customized information and gathering expectations through a multi-channel way. So this is my vision about health innovation. I think in Andalusia we did well, they did well, but my message for Canada, for Vancouver, is that you have everything to go further. Thank you very much, and I will love the discussion. Thank you.
So Pablo, thank you. That was
25
tremendous.
minutes.
25 minutes. We owe you $20. Well done. But first of all, that was a very incredible, I think, commentary of what has been achieved within an integrated approach in a common system. I have a couple of questions for you, Pablo, and I think many people in the room will have some questions as well. But I guess a fairly fundamental question, you maybe covered it, but I missed it, was how long has this journey taken in Andalusia, and how much did it actually cost to take this model forward?
Mm-hmm. So it's one of the key questions. So in 1996, 1997, in that moment I was I had the position of deputy minister, but not in Andalusia, in another province of Spain, which is Balearic Islands, Mallorca, Menorca, Ibiza, Formentera, 4 islands, 1 million inhabitants, so I used to be the deputy minister. And we started to see what was happening in Andalusia, in the south of Spain, because Andalusia was one of the less developed regions in Spain. So for example, in Balearic Islands, we had a lot of money, in Madrid, in Barcelona. But Andalusia was some of the less developed regions in Spain, but they started to move the political agenda. So in that moment, the minister, Francisco Vallejo, he started to say, I don't understand why we have waiting list with a system with, if we have a budget of $12 billion a year. So we have to change it. And he asked for a new approaches. And people started to speak about integrated processes, about electronic health records, about citizen engagement, about having a key role for the health professionals. So the main thing they did, first thing, and the very important thing, is to move the political agenda from speaking about beds, emergency rooms, and creating more hospitals. Of course, you have to do that, but this is not everything. And you can see that this is not solving the issue, this is not solving the problem. So they moved the agenda from speaking about beds to speaking about processes, to speaking about involving the citizens, to speaking about involving the health professionals. So they started in 1997 with a big strategy of redesigning clinical processes. They started the electronic health record project in 1999, and now they have amazing results. And I can say that because I joined then in 2003, so the 90% of the work was done. It was not my goal, and now they have by law the guarantee of having no one waiting more than 120 days for surgical intervention, to have no one waiting more than 60 days for seeing a specialist, or 30 days for a diagnosis test. So first thing, leadership and to move the agenda. Second thing, to involve the health professionals. And of course, one of the key things in this process is not the budget, is not the technology, is the change management.
So Pablo, this is clearly a very integrated strategy, and many of us are all struggling in our respective parts of our system, looking at different parts of the system. But what strikes me in the model that you've shared here in Andalusia is that you've taken a fully systems approach. There's a fully integrated systems approach. And one of the things that came up in conversation last night over supper was the issue around the involvement of health professionals and how you pay and remunerate and engage your physicians. Do you want to just share a little bit about that 80-20 split and how that actually works? From my understanding, your clinicians are employees of the system. They're salaried employees, and yet you've managed to get a mix, a fairly unique mix of payment and incentive.
Absolutely, thank you. So that's right. To involve the health professionals is one of the key things, as I said before. And to involve the health professionals are employees of the system, but on the other hand, I have to say that they have a lot of power. They have medical associations, and they have a strong position in the society as well. So we started involving them in redesigning the care pathways, and we started to involve them from the beginning in all the strategies. At the same time, in Andalusia, we created the management by skills approach. Management by skills means that each professional of the Andalusia health system has his or her own map of skills with your current and future skills. And the health system is working with you as a professional in improving your skills. And you are having normally 80% of your salary by fixed and 20% variable. And the 20% variable depends on the performance and the improvement on your skills. So the analysis was, if we are in the knowledge society, and it's very important, and it's very important for the health professionals to improve skills, let's go to put the focus on the skills and improving the skills, clinical skills, communication skills, management skills for each professionals. Let's go to accreditate the skills, and let's go to link the salary with not only with the traditional performance, but in addition with the improvement of the skills. So the idea was to create a system absolutely focused in knowledge management. So in creating management in each professionals, working with each professionals in enhancing the knowledge and in enhancing the skills, and having these skills absolutely related with the strategy of clinical processes and with the clinical and health and outcomes and the citizen engagement.
Okay. So we talk about measuring the degree of change through the question of degree, the number of degrees, 180 degree change. When Pablo left Spain, it was 40 degrees. And when he got to Calgary, it was minus 40 degrees. So there's an 80 degree sea change in life. So
That's right.
Pablo, tell us a little bit about how you have been working with Calgary to advise them on their strategic direction around their journey. And perhaps in that response, tell us what you found most challenging in terms of translating the Andalusian vision and model into the Calgary experience.
Mm-hmm. So when I arrived in Calgary in the first months, I started to see a lot of projects going on, especially in citizen engagement, but my surprise was that there were a lot of projects going on, but without connection, without an integrated view. So this is that was one of my surprises, to have a lot of very good people working in a very good project, but without connection. So my first recommendation to Jack Davis, the CEO, and to Chris Eagle, the president of the region, was to create an integrated vision. It doesn't mean to have control of everything. It means to have an integrated approach and to have, especially in citizen engagement, a unified view of the citizen. Because the citizen doesn't understand about our silos, about our bureaucratic organization, about if I am the VP of citizen engagement, but he's the VP of advanced technologies and he's the VP of planning. People want services and people want a unified approach. So let's go to work in this unified approach. And for that reason, we started to create this unified vision and integrated strategy. Now we are working in integrating the approach of the different channels in citizen engagement. And one of the big goals now is to avoid the traditional silos and to go forward toward an integrated approach in the cities. This is especially in citizen engagement, and this is the big challenge. So to move from a traditional silos perspective to an integrated perspective. And it's not easy, of course, because it's not only about introducing a customer relation management system, it's about a big change management process.
So you've been there, I think, just a little over a couple of years now? You've been there 2 years, 18 months, 2 years in Calgary?
I arrived in August 2007.
Okay, so it's early days. What do you see, how are you going to measure or demonstrate the success of the adoption of the strategy in Calgary? What will be different? What will the consumer and what will the staff member in Calgary Health Region, which of course is a wonderful health region, I used to work there. But how will they measure success? How will they see things differently following this new innovative approach?
So in terms of, I think one of the key things will be, if possible, to clarify the navigation of the citizen across the system, to have, if possible, a personalized and customized information, services, and possibles of participation. Because you know navigating in the system is very difficult. So I arrived with my family, 1 4-year-old baby. My wife came pregnant, so we had a little Canadian and Spanish baby called Sofia. But I have to say that for me, I have the level of vice president in Calgary, it was very, very difficult to find out where to go, to find out where the information was, to find out where are the appropriate service. So, and it was for me that theoretically I'm an expert and I'm delivering speeches about that. So you can imagine people coming from another countries or people from Canada who they don't know and they don't have to know about processes, about integrated perspective, about. So one of the big goals would be to allow the people to have a easier navigation of the system, to have personalized and customized information, and to improve access and possibles, and to know where to go and why they are going in some place.
Yeah, that's a very good answer, Pablo. So one of the features of the breakfast sessions is very much an interactive piece here. And I think, Pablo, today many people have been stimulated by what they've heard, and I'm sure they have many questions. So I'd like to broaden this conversation a little bit and invite anyone in the audience to perhaps share an observation or have a question or two for Pablo. So now that you're all suitably awake and had coffee and had breakfast, let's just broaden this conversation a little bit.
Hi, Charlotte Black, ABC. Thanks for a great question.
Thank you.
Howard, you mentioned the focus group system, and I've heard you talk a lot about processes and about data. And as a researcher, I'm interested in how do we know when things are together. So can you tell me a little bit more about how you're using this information to measure system performance so that you can see system performance, so that your CEO can understand changes that have been made, improvements in processes.
Absolutely.
And a little bit on that, Pablo, to broaden that, it's cause and effect, because life is multifactorial, systems are multidimensional. So I think everyone knows in our world, you touch something over here and something pops out over there. So maybe just take that question and also think of the cause and effect piece. In your talk, you showed of reductions in wait time and improvements in access from 6 weeks to 2 weeks or whatever the data was. But maybe just think of those two themes when you're responding.
So this is the structure of the electronic health record. So you have the database, you have the health record, you have the centralized appointment, the electronic prescription, multi-channel contact center, and this is the module for the secondary use of the information. And secondary use of the information from the operational perspective, so you have all the information in terms of the performance and the outcomes of each professionals. You have information from the tactical point of view, so you have the information of each unit and each hospital and each primary care center. And you have strategic information as well, in terms of information about topics for all the health system. In addition, this is related with the balance scorecard that the people at the highest level of the organization, they have a balanced scorecard, a personalized balanced scorecard in terms of the goals and in terms of achieving the goals. And you know that the balanced scorecard, in addition, is a tool for communicating the strategy, not only for having more data about the strategy. And thanks to the integrated approach to redesign the care pathways and to have the electronic health record and this type of information, they can do things like having the guarantee by law of having no one waiting more than 120 days for surgical intervention, because they have online all the information from the operational perspective, from the tactical perspective, and from the strategic perspective. So this is only the top of the pyramid, but it's a very important tool in terms of having information from the management perspective, but in addition, a lot of information for research as well, because you have the accumulated information of each 800 people with a system with 50 million of operations a year.
Okay, thank you. Anybody else?
My name is Laura Fitzgerald from Johnson & Johnson. A couple questions that I have can I ask you?
Of course.
And they are unrelated. The first one is, in January 2008, the Calgary Health Region restructured, and they have restructured. What was the impact of some of these thoughts that you're talking about and those plans? What was the impact on the restructuring?
Mm-hmm.
Because trying to figure out the restructuring
Mm-hmm.
philosophy is behind it.
Yes, so I had some discussions in the fall of 2007 with Jack Davis and Chris Ebel about this type of ideas, about having a integrated approach, especially in citizen engagement. So, and you are right, in January of 2008 they changed the structure of the organization. And before the reorganization, in the Calgary Health Region had one vice president for community relations, another vice president for patient experience, another vice president for wellness, another vice president for health promotion, and now they have only one president in charge of citizen engagement, who is Joanne Staliski. So I think they listened to me, and they changed the organization in terms of avoid to have too many silos and to have an integrated approach from the organizational point of view. This is not enough because you have to do things, but it's one of the first steps.
Okay, and the second point?
And yes, my second question is, I understand that the Calgary Health Region and the University of Calgary strongly collaborate.
Yes.
Within your model, I was looking in, within the model that you were looking at in Andalusia, I didn't see the academic institutions and what their role was within the restructuring and redevelopment of health innovation.
Mm-hmm. This is because they only gave me 25 minutes.
They only gave us an hour.
But you are right that it is a very important thing, and in Andalusia they are working very closely with the university from the clinical perspective, from the research perspective. They are doing a lot of things, and from the innovation perspective. For example, in the new technological and multi-channel approach, normally this type of projects are done with partnership with the university, in terms of creating as well not only multidisciplinary teams from the health perspective, but in addition to have multidisciplinary teams from the health perspective, university perspective, the companies, and to create this type of cluster. For example, in the Bank of Innovative Practices, first year we got 300 of best practices, and most of them, in most of them, the university was strongly involved.
It's also fair to say in Calgary Health Region, going back to a former life, we made sure that every senior clinical leadership appointment was also a joint appointment with the Faculty of Medicine. So each of the regional clinical department heads and executive medical directors have a joint academic appointment with the Faculty of Medicine in Calgary Health Region. And that's been a really important part of the link with the university and the co-management model, the co-leadership model that was taken forward in Calgary in the 1999, 2000, and still exists today.
Ray Simkus, I'm a primary care physician, and I was wondering if you could comment on how you engage physicians in Andalusia.
So the first step and the first thing was to understand that the leaders, the highest, the senior persons in the organization, we didn't have the ideas. The physicians and the doctors and the multidisciplinary teams, the different health professionals, they had the ideas, they had the knowledge. So the first thing was to put the focus on the health professionals. And the health professionals from the perspective of clinical processes, from the beginning and the strategy in terms of identifying the main clinical processes and to give the health professionals the opportunity with a quality methodology of redesigning the clinical processes. Same thing in the electronic health record. The electronic health record is a tool especially for the health professionals, but in addition for the citizens, and in addition for the managers of the system, but especially for the health professionals. So we didn't want to deliver a standard tool for the health professionals, this is your electronic health record. So we wanted to ask the health professionals, how do you want electronic health record? You have the opportunity of working from the beginning in that. And in addition, I think another important thing was to create this strategy in management by skills in terms of creating a specific map of skills for each professionals and to work together with the professional in improving the skills. So our understanding was if we are in the knowledge society, who has the knowledge? And we found out that we didn't have any knowledge. It was owned by the health professionals. So different approaches, different strategies, but with the comprehensive view of knowledge management and of understanding that the people who have the knowledge, they are the health professionals.
Thanks, Pablo. Louise, you had a question.
Louise Bravo from TELUS. Many of us here today are from the technology sector. I would like you to comment on how technology is helping transformation and support of the new process.
So from a very important point of view, because a very important perspective, because you can redesign care pathways and you can redesign processes, and this is very important, and this is the first step, but without technology, you can't continue. So, for example, the electronic health record is basic tools in order not only to have the information, but for example, in terms of citizen engagement, the centralized appointment, you can have as a citizen your appointment through different channels and through SMS, through the web, through the regular phone, through the cell phone, the electronic prescription, as well in terms of citizen engagement, in terms of delivering the information from an integrated perspective, to have the possibility of cataloging the digital resources and to have the possibility in working in this new technological environment of the technological convergence. So I think without the technology, it would be impossible to do, of course. So I would like to put the focus, of course, in redesigning processes, in involving professionals, but as well in technology. The technology is very important, and I think especially the electronic health record, but in addition the multi-channel tools for citizen engagement are very important as well.
Thanks. So probably there's one last question. I think we're getting very close to time.
I'm Paul Mathias, I'm with Bill's Healthcare. In Andalusia, your one region of Spain, do you have any metrics where you could compare Andalusia to other parts of Spain to determine the success of what you have done?
Yes, there are because the organization in Spain, the political organization is very similar than the Canada one. So we have 17 provinces and we have the federal government. So at the federal level, you have the health ministry, and the health ministry has a specific organization in terms of metrics, measuring, in comparing the different regions. And one of the amazing things is that in Andalusia, they started to do this type of stuff, and the rest of the regions started to see that, and now the rest of the regions are doing more or less the same type of strategy that Andalusia started at the late 90s. But of course, there are a lot of comparative reports between regions, measuring the different clinical outcomes, health outcomes, the use of electronic health records, the use of electronic prescriptions. So you have a specific unit in the ministry only to measure from a comparative point of view the different provinces, the different regions of Spain.
Will you have the same access to the same metrics in Alberta for your efforts in Calgary?
No, I don't have it.
Yeah,
No, I don't have the same type of information.
Yeah, I mean, Alberta have done many good things around the whole areas, but we're in Canada, we're coming from a very different starting position, I think. In BC, we have electronic prescribing, and we have a community pharmacy and a secondary care pharmacy record where online, electronically, I think everyone's aware in this room, we can see the entire patient episode around pharmacy. But that's unique. That doesn't exist in Alberta, doesn't exist in any other province. So across our Canadian landscape, we're all coming from a slightly different beginning, a different journey. But I think the experience that we've heard this morning from Spain shows what can be achieved with a different lens, a different approach, and a different focus. Clearly, there's no one best way to achieve this vision, but I think there's much to learn from the experience, and I guess that's why Jack and Joanne and the team in Calgary felt it was important to have Pablo join the team and help steer their journey towards a completely different paradigm of healthcare. So it's very exciting. And that segues over to Anton.
So thank you very much, Pablo. First, I'd like to publicly invite you to come back in about a year.
Okay.
Is that agreed? We should have him back. Just give a report card on Calgary. So it's a wonderful presentation, and
Thank you.
I think people have clearly shown their attention and their interest. So, and Howard, thanks for facilitating this and bringing the perspective of both Alberta and BC to the picture. So that's great. These two people, on their behalf and on your behalf, donations are made to a charity in Calgary that deals with very poor children. Pablo has asked for that, and a Victoria Foundation on the island. Thank you for coming to breakfast with the Chiefs.